Hey everyone, you're listening to InfoQuench with Jeff,
and Amy,
a podcast with tips to make your life easier.
covering pop culture, parenting, travel, minimalism, and more.
Hey everybody, and welcome to InfoQuench. I'm your host, Jeff.
And I'm Amy.
And man, oh man, did we have an informative, amazing, mind-expanding, creative show for you.
Way to set the bar high, hun.
It's just what I do. People expect it from us now, honey. We bring the goods.
Yeah, so we're 26 episodes in. We better bring something to the table, I guess.
I know. This show is, okay, before I get into what the show is about, I just wanted to thank Don and Jay Paquette of Nova Scotia. We met them in Jamaica, right?
Yes.
And we had a great time in Nova Scotia, and they're huge fans of the show, so we thought we would just give them a special shout out. And if you're a huge fan of the show, let us know, and we'll give you a special shout out, right?
Yes. And, when we were down in Nova Scotia, one of the questions that came up, so Jay and Dawn live on a beautiful lake, Lily Lake. And we have a Lily Lake here in St. John, New Brunswick. We were actually married in the pavilion on Lily Lake in Rockwood Park here.
That's right.
And so it was interesting when they said they lived on a Lily Lake in Nova Scotia. But one of the questions I asked when we were there, because there was it was an outdoor event and, a lot of wood around. And I asked if there were a lot of deer in the area and if there were, a lot of cases of Lyme disease. And it sparked a lot of discussion, and really that's what's inspired this episode is sort of that discussion that a lot of people are having now around Lyme disease.
Lyme disease. It is a fact of life now. If you want to go hiking in the woods, you're bound to pick up a couple of those critters, and they're not they're not all bad. Well, they're all bad. They're just, they burrow in your skin and stuff, but the ones that are really bad are very bad.
Yes.
And that's what we're going to talk about,
very
right?
Bad, yes.
Yeah. I know you have all the details and all of the facts, and you just bounce them off me, and let's see what happens.
Well, when we were in Nicaragua, there was a night, a morning, Huck's woken up, and he had our son Huck's had a bug bite on his back.
That's right.
And it was distinctly a bullseye pattern, the bite. So anybody who is in a Lyme hotbed area where there are a lot of ticks that carry Lyme disease is aware that bullseye is sort of the trademark rash that everybody talks about anyway for Lyme disease. So of course I was alarmed when I saw that. Now good old Google search showed me quickly that Lyme disease is not in Central America. And it was likely just a spider bite. So it was one of those times where I was actually happy for him to have been bitten down in Nicaragua rather than just home here in New Brunswick, because here it would have been a rush to find out whether or not there was a tick. And so we're going to just talk a little bit more about all the details of Lyme disease, because we had another scare recently. Just a last end of school trip into one of our local parks, and Hux came home and he had a couple of bug bites, but I did a tick check because that's, again, we're in New Brunswick and it's
reality now.
It is.
Truly.
There's a lot of Lyme disease around, so we did a tick check, and I'll talk a little bit more about that later, but I didn't find anything. But so this is I think it was midweek, but by the weekend, he was very lethargic. He started to present with a fever and complained of a headache for about 3 days.
Oh, yeah.
Which is very strange for a 6-year-old, and he's not often sick. He really doesn't get sick often at all. So we decided to make a trip to the family doctor, and although she didn't feel it was Lyme, she said Lyme tends to present more aggressively, and she'd actually seen quite a few cases of it. You got to take all the precautions. We were proactive, and we got a course of antibiotics. So for anybody who's curious, the course of antibiotics that was prescribed was 14 days of amoxicillin.
Right.
So we decided to go through that. Huck, again, he's not sick often, so he's not on a lot of antibiotics. I don't like to overuse them or,
It's generally not a good thing anyways to overuse antibiotics.
Well,
you become
no.
immune to them,
exactly, yes. Bugs become resistant to it. And
yeah.
So, but we did go through the course of them. His symptoms actually seemed to subside after, a day or so anyway. But of course, with all antibiotics, you finish the course. But it really just, put a scare into us around Lyme disease. And it used to be that we would spend a lot of time hiking in the woods. And I have to say, Lyme is keeping me personally out of the woods.
Yeah, I know. Even you can contract, like you can get ticks just from staying on the very well manicured trails in some of our parks, just from like the copious amounts of deer. Really.
So let's get into a little bit about what Lyme disease is. And again, if you are from New Brunswick area, you're probably quite familiar. There's a lot of discussion around it now. I went to a safety conference just last year, and one of the questions, one of the sessions I attended was specifically around Lyme disease. There's a great website, Lyme NB, NB is in New Brunswick, that has a ton of information. It's, a wealth of information. But one of the questions they asked at the end of the session was, does anybody know somebody with Lyme disease?
Mm-hmm.
And I think every hand in the room went up.
Yeah, it's scary.
And including my own. And they said they asked that question as recently as 2 years ago, and they would get no hands up.
Wow.
So that's how quickly.
That's how prevalent it is.
And also just, the awareness of it. So people are getting tested and they're getting diagnosed properly too. Whereas before, I've there's a lot of discussion around whether MS or other illnesses may be Lyme disease that has actually been misdiagnosed.
So I have a quick question. Like Lyme disease in particular, is it just an infection that can't be fought?
Right. So it's a bacterial infection.
Okay. That's what I thought.
So let's go back to the beginning. So Lyme disease, it's a zoonotic disease. And what that means is it's a type of disease that's spread from animals to people. Zoonotic.
Oh, zoonotic.
And it's caused by a particular bacteria, a bacteria whose name is very difficult for me to pronounce.
Yeah, don't bother. It's okay. Just skip it. No big deal.
Borrelia burgdorferi. See, I had to give it a shot.
Yeah, you did it.
And it's spread by the bite of infected black-legged ticks, which are also known as deer ticks, which is why, around here we have an incredibly high deer population.
Mm-hmm.
And particularly, even in residential areas, not just out in the woods, but they're right up at people's doorsteps. So I think that's definitely contributed, to Lyme disease in the area. And the symptoms can come anywhere from 3 to 30 days after you've been bitten by a tick. And there's quite a range. I've seen everything.
3 to 30.
Yeah.
Can you imagine if you started getting the...
Some sites say 7 to 21 days, but I'm going to say 3 to 30 to kind of be...
Like if you started getting, the symptoms of being bitten by a black-legged, is that what it is? Black-legged tick?
Yes.
At 30 days, I mean, you wouldn't, you may not even think it's that if you hadn't been in the woods for like the longest time.
Well, I know. And then the symptoms are fever, muscle pain, joint pain, headache, and then of course the characteristic skin rash, known as the bullseye rash. And what's scary though is even not everybody even gets a rash. I think only about 70 to 80%. Again, different statistics vary depending. I looked on the government Brunswick website and a few different sources, but around 70 to 80% of people even get a rash. And if you get a rash, only 9% of rashes, according to Lyme NB, actually present as the bullseye rash.
Oh, wow.
So we're all sort of looking for this bullseye rash, but it's not even, a good indicator because it's not something that's consistent and it doesn't happen in every case.
Mm-hmm.
So a lot of the symptoms that I described are very similar to the flu. So people can, be presenting with the illness of being infected by the bacteria.
Which was the case with our son. So we took precautions to possibly
right. He
fight
had his
it.
flu shot, so it could have been just a milder version of the flu. But we don't know. Either way, we did the antibiotics and he's doing better. So it's not something to mess with, and it's part of me wonders whether it's Mother Nature's way of just kicking us out of the woods.
Well, I mean, how long before ticks move out of the woods and into our homes? Like, I mean,
Okay, well that's it's interesting that you say that, because I'll get into a whole section here around prevention, but I think I'll jump to that now, because that's probably what most people are interested in.
Well, yeah. How do you stop them?
Well, I mean, the number one thing is, they say, avoid areas where ticks live. But if you live in an area that's a hotbed, and
what if you work in the woods?
Well, that's true. And if you do a Google search, you'll quickly see that Lyme disease is spreading very quickly. So most areas are areas where black-legged ticks are found and where Lyme disease is spreading. And there's been a lot of discussion. Even I saw a recent CBC story on the impact of climate change and how that's also exacerbating the spread of Lyme disease, because ticks can they live longer. They have a longer season. So in terms of avoidance, yes, try to avoid the areas, specifically along the edges of the woods, forested areas, places with woody shrubs and tall grass. If you are on trails, you try to avoid walking along the sides of the trail. Stick to the middle so that you're not kind of rubbing up against the trees and shrubs. You should use an insect repellent if you are in the woods. Something with DEET. And
which is
horrible
another stuff, but it works.
I know, and that's what's so difficult, right? You want to go out for a hike, you think you're being healthy, you're getting some exercise, and meanwhile you've got to put all these chemicals on you just to do it and feel
yourself.
safe about it, right? So there's permethrin is another type of repellent that can be applied just to the clothing rather than to the skin. But again, you always wonder, you're using these chemicals. What are they? If you're using them in the long term, what effect are they having? At that particular session I went to at that safety conference, I said even some local stores, I think Mark's Work Warehouse is one of them, that sell clothing that is treated with.
Right, but it only lasts so long.
I think 80 washes. 80 washes is what they'd said for the particular brand that they had on site.
I'm sure that capitalism will come up with all kinds of different ways to combat these ticks to make money. You really want to do something though that actually works. And in all honesty, I think that probably DEET would be really spraying things that they actually hate and repels them would be the best thing. And
then, of course, just, making sure you're covered up, too. So wearing long socks, long pants, tucking your pants into your socks, because that's always a great look. But who cares if you're protecting yourself?
Oh, yeah.
Long sleeve shirts. And, obviously open-toed shoes and things like that would expose your feet to ticks. So you should have, closed-toed shoes. They recommend light-colored clothing so that you can spot the ticks easily. And make sure that you do a thorough check when you come in and check your kids if they're out playing. And again, they say if you're in a hotbed area, you should be checking your kids every night. It should be a nighttime ritual. Brush your teeth and check for ticks, and checking the back, checking around the scalp area, behind the ears, the neck. Anywhere where there's hair, they said even like in the belly button, back of the knees, the groin area. Those are all some of the key areas, but you should do a thorough check. And then they say to, then do your bath or your shower. I
think I'm going to have a nightmare. I really do.
I know this is a really upbeat episode.
I know.
But it's important stuff.
It is really important. And, perhaps, even if we are telling you one thing that you didn't previously know, well, great, that'll perhaps help you not to, get Lyme disease, which is a win for us. Let us know if we stopped you from getting Lyme disease.
Yeah, if there's a way to do that. Things you can do around your yard is, don't leave a lot of leaves around, clear away any, brush, tall grasses, keep your lawn trimmed, mowed short, put any playground equipment, decks, patios, keep them away from the yard edges, away from the trees, and put them in a nice sunny location. Ticks can hitchhike inside on your clothing. I'm picturing a tick with a thumb up.
Hitchhike.
But they can
go my way.
And on your pets and your outdoor gear if you had a backpack hiking. And so they can...
What do they have, little barbs or something like that on their feet to be able to
Well, they can't jump or fly or anything like that, but they're really just, if you brush up against them, they latch on.
Wild.
They latch on to animal hosts as they go by. So even if a pet is vaccinated or wearing a repellent collar, a tick will still take the opportunity to hitchhike in
anywhere
and then drop off the animal and try to find a host. So
wow.
they say if you're if you spend a lot of time outside in the woods, you should be drying your clothes when you come in. Wash them and dry them, and anything that's been outside that could be infected with ticks at high heat for a minimum of 10 minutes. So it's the heat that actually kills them. They can live through a wash cycle, but
that's insane.
I know.
They can live through a wash cycle?
Yes.
How many out
but
there
if you are
listening knew that?
I know. And if you are washing your clothes, wash them with hot water, but the high heat of the dryer is really important. Now,
man,
some places say that if your clothes are damp when they come in, that they should be at high heat of upwards of 60 minutes. So I guess, that's just regular washing and drying your clothes, but just making sure that you don't throw your clothes into the hamper because the ticks can move on to other clothing. If you can't wash them right away, to bag them up. It almost sounds like bed bugs.
Yeah, I was just going to say, it sounds, and they even look similar to bed bugs, don't they? They have the teardrop look.
Yes.
To them?
Yes.
Oh God.
You could try to describe them, but it would be easier just for you to Google them. And as far as timeline goes, showering and bathing, they say to do that within 2 hours of being outdoors, to try to get them off you and make sure that they're
what
gone
if
and
you're
don't reattach.
on the fundy path and you're just going for weeks?
Well, that's a good question.
What do you do?
You do the check, and
the checks are the most important thing, I would say, right? Because if you don't find them,
and they have to be attached for. This is pretty consistent information that I've read, is that they have to be attached for at least 24 hours. So it's during the feeding that they actually transmit the bacteria, and so it's usually between 24 to 36 hours that they will begin feeding on a host. So if
are they parasites?
Yes.
Or are they just regular? Oh, wow.
Well,
they are. If they're feeding on a host, that's
yes.
a parasite.
And
I'd say.
So, the biggest thing you could do is do the tick check, and then you remove them. So.
And do you have information about how to move them properly?
How to remove them? Yeah, use
Of course you do.
Yes, of course I do.
Duh.
Again, a lot of people know this.
How do we make them
but
pets?
I think
That's what I want to know.
Use some fine-tip tweezers. And you can even buy special tick removal devices, but the key is to grab it as close to the skin surface as possible. You don't want to squeeze the tick, because if it's full of blood and full of the bacteria that it's going to transmit, you'll basically just squeeze it into you. So you want to grab it close to the skin surface as possible, and then just pull slowly upward with a steady, even pressure. You don't want to twist it or crush the tick. Then wash the bite with soap and water, and or just disinfect it with alcohol or any other household antiseptic you have lying around. So if you have trouble, removing it, just ask someone else to help you out. I guess it's depending on where it's located. It can be located in some tricky areas, and it's recommended that you save the tick that bit you. So you put it in there goes the street sweeper.
Yep,
We got nice clean streets. Nice clean streets tonight. Put it in a sealed container, record the date of the bite, and that way if you develop any symptoms, you can have that to assist with some of the testing.
Wild.
Now, some people will recommend, one other thing is, if you do save the tick, which is recommended, you put it in a small bottle with a damp piece of cotton. Wow. This was, I guess, to help preserve it.
It doesn't dry out.
Some people recommend removing it, by painting the tick with nail polish, or pretty fancy, right?
Really?
Jeff's face when I said that.
Really?
Yeah.
Painting it with nail polish?
Or petroleum jelly, or using heat to burn it, or the tip of a match. Don't do that. Don't do any of those techniques, because it'll just irritate the tick, and it can regurgitate its...
It'll get pissed.
It'll regurgitate its stomach contents into you.
Oh, jeez.
So that's when the transmission will happen. So that's why it's important to just use tweezers and grab as close to the surface of the skin as possible and not squeeze.
Where's the good news in all of this? Is there any good news?
Well, that if...
Being informed, right? And so that you know.
Yes, if it's tick, if you are treated, it can be treated successfully. If Lyme disease is...
I'm fearful for my life. You realize that.
If it's treated in the early stages, there's almost always a full recovery. It's in the later stages that it becomes more persistent, and then you can have it can cause neurological symptoms. It can affect the heart. I mean, it's a bacteria that can spread and cause a whole
host of things.
Yes, a whole host of things. So
wow. I mean, is everybody's symptoms when they get the ticks, are they the same?
From what I've read, they've been quite consistent. But then at the same time, when you look at... So the initial symptoms are consistent. Now, people who've had Lyme disease for some time and have no idea that it is Lyme disease, it can present in all kinds of
fatigue,
ways.
Though, is a huge one.
Chronic fatigue is sometimes it's Lyme disease misdiagnosed. Yeah, but fatigue is a huge one. Chronic pain. I know that and we know a few people who have Lyme disease personally, and a lot of people here are going south of the border, like down to the United States, to seek treatment, because I think it's been down around the New England area, and it's been there for quite some time, and there are some specialists down there. One of the doctors that I've heard a few people mention is Dr. Maureen McShane, out of Plattsburgh, New York, and she's extremely well known. She has Maureen, I think it's Maureen McShane MD.com. She has a wealth of information on her website, and she's treating so many people that when people are going across the border, if they're when they're asked by Border Patrol, if they mention her name, they're like, you have Lyme.
You have Lyme.
That's her specialty.
Well, did you, not to change the subject too much, but did you hear about those self-replicating ticks that killed cows in the United States?
Yes.
They don't need a mate. They can just make more.
That was a true thing?
Yeah.
Oh, okay. When you told me that, I wasn't sure if it was like
I'm pretty sure it was. That's pretty scary.
That's
like Hollywood blockbuster movie scary.
Yeah, that's...
Anyway.
That is really... Yeah, they suck
bring up
the
that
cows.
there's zombie ticks coming for us.
They suck the cows dry of blood.
Yeah.
Ooh.
I know.
Oh, that's awful.
Anyway, on to more positive tick news.
Well, Dr. McShane has some additional tips. A lot of the tips that I mentioned are pretty common ones, but some of the other things that she'd mentioned was that she said even low exposure areas may not be safe. So in cities, for instance, you may think that you're safe
from ticks,
but ticks can ride on migratory birds. So.
I thought you were going to say they ride on Harley Davidsons and come after us. Honestly,
why? You just hate loud motorcycles. That's why.
I do. Yeah.
Yeah. They know you like ticks.
Oh, man.
No, but they can ride on birds. I mentioned pets can bring them in. So if you do have pets, they shouldn't be sleeping in your bed. That's probably one of the easiest ways for the ticks to make their way to you. Outdoor pets should be checked for ticks and brushed daily. I mean, this is like a full-on... I would need a full-time job just around tick and Lyme disease prevention.
I know.
I'm like, I'm not even going to have a pet. It's too much work.
No.
Just around the ticks.
We have an indoor cat. Hopefully he doesn't contract a tick in any way.
Well, they have to go out.
I know. That's what I mean. And get it from us.
Yeah, we're the culprits. He's like, we come in and Charlie's checking us for ticks.
I know. Meow, meow, meow.
Bringing them in. Oh, I've heard, I don't know if this one's true or not. I've heard cats can't get Lyme disease.
Oh, well, I have no idea.
They have some sort of natural immunity.
I can't confirm that. I have no idea.
I'll just spread that.
Excuse me.
That could be some fake news coming your way.
Fake news.
Yeah.
Wow.
You love that terminology. So, but if you do have an animal who's acting ill or strangely, take it to the vet, and Lyme disease may be part of your discussion. In your yard, you can grow certain plants that deer just don't like, so it helps keep deer away. Deer, again, are like the number one cause. They can carry hundreds of ticks.
But rabbits have it, everything.
Mice are an easy way to transmit it into the home. Particularly if you have bird feeders in and around your home.
Is there a way to eradicate them, though? Like completely almost? I know they're part of the food chain and they probably shouldn't be, but what good are they doing?
The ticks?
Yes.
Well, I guess they're, I don't know.
Nothing. They're just killing cows. Anyway.
I know. And it's scary. I think it's scary because we know people whose lives have been so largely affected, and it's affected,
Yeah, it can happen to anybody.
Every aspect of their lives because they're
dealing with a child.
It can, and I'm just pissed off because
Me too.
I loved hiking in the woods.
I know, me too.
And now
and
I'm terrified to go into the woods.
Those ticks really ticked me off.
Yeah.
It's really, that must be where that expression came from, because you want to get the tick off you.
I bet you it did.
Yeah.
You'll have to look that one up and let us know about it.
We'll do that in one of maybe of our Insta stories or something, whether or not I'm right. Is this a time when Jeff is right? Who knows?
Could be.
Find out.
I talked about testing. I just want to touch on one more thing. There's a lot of controversy around testing. So typically, in terms of a diagnosis, here in New Brunswick, it's based on a physician's assessment of the patient's clinical symptoms and the risk of exposure. So was there a risk that they were exposed to black-legged ticks and were potentially bitten? And then laboratory tests can then be done to confirm. So New Brunswick follows Canadian national testing guidelines for Lyme disease. So it recommends a two-tiered testing method. Right? It's pretty extensive.
That's pretty.
So it includes a screening for a particular enzyme immunoassay. It's called ELISA. And then it's followed by another confirmatory Western blot test. And then together the two give you more accurate results. And it's currently recognized as the best laboratory method available for supplementing the clinical information on Lyme disease. So these testing protocols have been validated by the scientific community and have been peer reviewed. So it's important to know that there are some private laboratories that are offering Lyme.
So you can get
testing.
Conclusive testing that says, yes, you have Lyme.
Right.
Wow.
But there are private labs that are offering testing as well. And just, do your research, look into it, because there are some that aren't using proper testing protocols. And it can be equally as dangerous to be misdiagnosed with Lyme disease. You could be getting treatment that maybe you have contraindications for, or you could have some other disease or illness going on that needs to be treated.
Mirrors
that
Lyme disease.
That then doesn't get treated appropriately.
How did it get the name Lyme disease?
It's after the person who discovered the bacteria.
See, I knew you'd know.
Yeah.
Amazing.
But
You're amazing. Isn't
I
she,
don't know
everybody?
Yeah.
Why
but
married her?
I'm not that amazing because I don't have his name here.
It's okay. You knew it was named after somebody and why. That's great.
But I had looked it up and I was like, why is it called Lyme disease? Because of course I put the lime in the coconut and drink a bowl up.
Oh, there's your one joke.
I know. This has been such a serious episode, but
yeah, thanks for
sometimes we just got to cover some serious stuff and throw a lot of information at you. So it's just a start. Again, Lyme NB have a great website. The Government of New Brunswick website's great. And then MaureenMcShaneMD.com is a specialist south of the border that you can check out. South of the border from Canada, I should say.
So really what the moral of the story is always check after you've been in the woods.
Yes,
just
check
do
yourself,
checks,
check your
period.
kids, check your pets.
Check everybody. Check it, really.
Yeah.
Because the earlier you catch this, the better.
Stay safe, everyone.
Stay safe and stay
Easy for
safe.
you to say.
Yes. Thanks for listening, everybody.
Bye-bye.
Bye. Thanks for listening.
Be sure to visit InfoQuench.com to subscribe and catch up on past episodes.
You can also check out InfoQuench on Facebook, Twitter, and Instagram.
Till next time.